Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are continuing on with our survivorship series today. We're going to be talking about emotional first aid after a diagnosis. What now? I have Kerri Reeves with me. She is a licensed social worker with our TMC Health Cancer Center. How are you today, Kerri?
Good. How are you, Maya?
Good. So you do have an online audience that's watching from home along with an in-person audience. So if you're watching us virtually, please feel free, if you've got questions for Kerri, to go ahead and put those into the chat and we'll address those after the presentation. Kerri, I'm going to go ahead and put your PowerPoint up for you so that you've got that, and I'll let you get started.
All right. Hi, everybody. I promised I would try not to wiggle too much because there's a camera, but it's nice to meet everybody. I've been a social worker for a number of years. I have been working in and around oncology since I was 18. It's my passion. There's something so special about a cancer patient that is indescribable. I want to talk a little bit about what it's like, what we experience when we face a significant illness like cancer or like heart disease. This does not just have to be cancer. This applies to all significant illnesses. So this is where it starts. I don't feel right. And this is just a blip. This is just a tiny view into the beginning of a cancer diagnosis or the beginning of a beginning to notice when your heart's not feeling right, or kidney disease, or whatever the significant illness is. This is just the beginning. We expect you as patients to jump through all of these hoops, and we want you to do it right now, and most of them are on fire. And your insurance is denying the authorizations as well. But you still got to jump through those hoops, and you got to get it done within 2 weeks before your next appointment. There's no time to process anything. There's no time to think about what you're going through medically, think about how your family is experiencing your diagnosis or the fears that they have, or who around you is impacting. So I want to talk a little bit about a survivor. Like I said, this does not have to be cancer specific. A survivor is someone who has been diagnosed with a significant illness from the time of diagnosis through the end of life, not when you stop treatment, not when you go on maintenance treatment, not after you've had a heart transplant or a kidney transplant. It's from the time of diagnosis through the end of life. So when we're entering the phase of survivorship, and our doctors, the phase of survivorship where we say, we'll see you in 3 months. That's what it feels like. That's scary. It's a scary place to be. Everybody thinks it's such an exciting place to be when your doctor looks at you and says, okay, you don't need to come back in 3 months. I'll see you in 3 months. You're doing amazing. I don't need to see you for 3 months. And that's typically what the frame doctors use in the very beginning. So this is the point where you really start to do all the processing. And it often feels like grief and loss. And there's a partnership of survivorship when you're going into the phase of survivorship where you're off of treatment or on maintenance treatment or just following with the doctor. This is where the grief and loss cycle is really prominent. So what is grief and loss? You're experiencing a bunch of different emotions. You've had a piece of you that you've lost, whether that's your health or a loved one. And why does it happen now? If we went back a few slides and you saw all of those things popping up on the screen and just a little blip of what it looks like at the beginning of a significant illness, you're too busy. You're too busy to think about anything but your medical health. You don't have an opportunity to process your diagnosis. You don't have the opportunity to speak to your loved ones about how they're feeling. or even the mailman or the lady across the road that's used to seeing you every day and greet them. We don't know how everybody's doing, including yourself, because you're too busy. And it typically, for a lot of people, what I see is if they don't begin processing the diagnosis in the beginning of their diagnosis, we see them processing it right now. And it comes out harder, and it comes out a little uglier, and it comes out a little scarier. I have not yet seen one patient who doesn't experience grief and loss with a significant illness diagnosis. Some of them have tried to trick me and say, like, I'm okay, I'm doing really good. And then they call me at that point where the doctor says, I'll see you in 3 months. And they'll say something like, you were right. We need to talk about this. And that's okay. I'm never going to tell you I told you so. A patient very early on in my career let me know that being diagnosed with cancer was like losing a piece of me. Feels like being in the middle of an ocean with your anchor down, sail up, and you're all alone. I am a social worker. I am not a great artist, but this is what we created together. And keep this guy in mind. So we're going to talk about this shark here in a little bit because he's pretty important. So Elizabeth Kubler-Ross developed this 5-tier model of the stages of grief and loss. And she coined it as a map: denial, anger, bargaining, depression, and acceptance. So denial is our anchor. That prevents us from moving forward. We cannot move forward when we're in denial. We can't move past that stage. And this is almost our brain's way of protecting ourselves in the moment because we're not able to handle any more input at that time. If we continue to ignore it, it won't be true. It can't be true. It'll go away. And we talked about it being a self-preservation or subconscious protection. So anger's our storm, and oftentimes it can be really scary, or it can be really sudden or out of the blue. Or like in Arizona, we could have sunny skies and then it starts raining. You hear a lot, this isn't fair. I hear a lot, this isn't fair. And it's not fair at all. You hear, why me? Why my family? Why my children? Why are we going through this? Oftentimes people will make someone in their lives a scapegoat and to deal with that anger. It can appear irrational to a lot of people, but it's healthy and it's therapeutic, and you should not stop the anger as long as you're doing it in a healthy way. Whether that's a rage room or talking to one of your best friends and saying, listen, I just need you to listen for 1 second and get it all out. Give yourself the opportunity to get this anger out of your body. And bargaining. That's our girl on the sailboat, just praying, I'll never drink again if you give me this one more chance. I devote my life to help others if you just take this away from me. This is a portion of kind of regaining control of your life. It helps you find balance in the situation. It brings some peace and resolution. And so it's a good stage to hit. There's nothing wrong with bargaining. I encourage patients to do this. So depression, the rainy days. The rainy days are often the longest cycle or the longest point in the grief and loss cycle. It is visited most often and revisited again. So this is one of those things that just doesn't go away. So it can continue to come back. We really want to look for those red flags if we're in this cycle. We want to look for maybe something that you used to do all the time, like you religiously made your bed every single morning, but you've stopped. You've stopped showering. You're skipping meals. Your family saying something to you. Those are red flags. Those are the point where it's important that you seek help or have somebody seek help for you. Sometimes you get so low that it's hard to say, I need help. I need somebody to talk to. It's normal. It is normal to be in this stage. Setting goals is huge. And that can look like, I'm going to stick my left foot out of the blanket for 10 seconds every 5 hours. That's a realistic goal. Start there. And that's okay. Celebrate every and any success. Like I said, if just sticking your foot out for 10 seconds is what you need, and you did it, and celebrate it. That's huge. And then, of course, acceptance is our sunny days, and sometimes it's so hard to see that. Sometimes we come there, we have accepted our diagnosis and where we are medically and physically, but then we leave it. We're only there for a couple of seconds, and then we leave it because we feel regret or we feel bad for feeling happy in those moments, but we hit it, so we know we're going to be back. It's a huge milestone, but don't be disappointed in yourself, in your emotional recovery, if you've hit acceptance and you leave it really quickly, because it's a different feeling with what you guys are going through. So this guy, this is our shark. And if you've been one of my patients and I've talked to you about processing your diagnoses, then we've talked about this guy. He's what looms under our boat. When we're going through this, when we're going through the grief and loss cycle, and we have any kind of additional loss, it can further complicate your processing, your diagnosis, or the grief and loss cycle. So that can be something like getting a flat tire. How many of you been to the point where you're having such a hard day? Maybe you're depressed, maybe you're angry, whatever it is, and then you walk out and you have a flat tire. It's defeating. It's angering. It could be losing a loved one being diagnosed with a traumatic illness. It could be your dog running out the door, getting in a fight with your loved one. It can be any of those things. Anytime you have those great white sharks building up underneath your boat and you feel like it's getting really restricting and really scary, those are good times to reach out for support as well. And having these conversations with your loved ones about that is important. So telling them, if you see me doing these things, I give you permission to reach out and ask for help because I'm going to need something. So we talked about, let's get her in and let her sit down for a second. Hi, welcome.
We've been looking for you.
Oh no. So we talked about the Elizabeth Kubler-Ross model as being a map. When it was initially introduced, it was discussed as a map that we should be going free-flowing through these stages and it should be really streamlined. It's not. So this is what it looks like. We bounce all over the place. And family and friends often think you might be a little crazy because one second you're happy, the next second you're screaming or crying. But this is normal. This is what it feels like. We go all over the place with our emotions, and that's okay. You're doing the work. So why does it hit hard in maintenance or completion of treatment? You've had time to process. You're no longer jumping through those hoops that are on fire with insurance denials. You've had time to actually process your diagnosis and what's been happening for the past maybe year or 6 months. You're not running from one appointment to another. You actually get to go to work. You get to go on those morning walks. You get to go to lunch with your friends. You don't have to think about, well, I have this echo and this scan and this blood draw and this follow-up appointment in the next 2 days. You have time. And you've had time to reflect from the moment you knew something wasn't right to now. So you're having a lot more time and opportunity to really process what you're going through. Now, what surprises did you guys face when navigating a traumatic illness? Does anybody want to share? Yes.
I'm a 3-time breast cancer survivor. The first 2 times, the surgery. Excuse me. I'm a 3-time breast cancer survivor. The first 2 times, the surgery and chemo and or radiation treatments were very clear. This 3rd time, not so much. The surgery was very clear, but the rest of it has been open-ended, and that doesn't make sense to me.
So not having a clear plan on what we're doing next and time frame.
Right. I'm a fairly structured person, and my experience with cancer has been very structured. And this feels a little too free-form, choose-your-own-adventure kind of experience
Mm-hmm.
that I've been trying to process now for 4 months, and I cannot make sense of it.
So something we haven't touched on yet is control. You've had all control taken away from you. You don't have a plan. You don't fully understand what your plan is and how long this time frame is going to be and what comes next. And you're a structured person. You've got to have control over your environment. We need to take control where we can. It's okay to tell the doctors, I don't understand. It's okay to say, why are we doing this? I had somebody recently tell me they were getting a second biopsy. Their loved one was getting a second biopsy on the same spot. And she said, why? And I said, ask. It's okay to ask these questions. It's okay to say, I don't understand what we're doing. And it's making me panic a little bit because I need to have that sense of control. It's okay to tell your doctor, I disagree with you. It's okay to tell the scheduler, no, I can't do that appointment. I'm going to go see my grandkids. Those are ways of taking control back because we've taken so much control away from you guys, especially for somebody who has to have a predictable schedule, predictable plan, a controlled environment. Those patients struggle just a little bit more than the others because then you feel out of control. And then how are you supposed to somewhat peacefully get through treatment if you feel out of control? Your mind is in a disarray. Question things. It's okay to do. Our doctors appreciate that. They want you to ask the questions. They want you to understand what is going on. And if you don't feel supported, we're going to talk about it in a little bit, but I want you to bring support with you to those appointments. Bring somebody who's a fierce advocate. Write those questions down before you get there. Hand them your list. And if you're not getting to them, your advocate will. And if you don't have support to come with you, reach out to the clinic. And hopefully there's supportive services within those clinics that can come with you to appointments. Is that helpful? Okay. Does it make sense?
It does.
Okay.
I have asked questions.
Good.
And you know that crickets noise?
That's what it feels like?
Well, no, that's what it was.
Yeah.
And
We got to get your control back.
so.
Before you leave, we'll get you my number so that way we can work on this together, okay? Okay. What other surprises? Who else would like to share a surprise? Yes.
Well, do you know, I was the only one who ever had cancer.
In your family?
No, that's the way I felt.
Yes.
And I had no pain, no idea that I had cancer.
Mm-hmm.
And it was such a shock, but I've had my husband help me. And so yeah, there've been a lot of surprises and it's hard to navigate that, but I thank you for having this meeting this morning because I've learned that 1 in 3 Americans have cancer.
Yes.
So that was quite a revelation to me. You know, I think we become so immersed in our own thoughts and concerns that we forget that there's a lot of people just like us out there.
Yeah, but you're right. It can feel isolating. It can feel like you're the only person who has cancer. You can be in a room full of family and friends and feel completely alone.
Yeah.
But then when you're diagnosed with something significant like cancer or heart disease, you start noticing little things. Maybe you notice the scar on somebody's chest from a heart surgery. Maybe you notice, well, that hair is probably a wig, or I know what's under that scarf. I know what that port scar is. You start noticing it all around you. Yeah, thank you. Yes.
The first time I've had cancer 3 times. And when I learned the first time I had cancer 22 years ago was similar to what Susan was saying. I learned that I had to speak up and tell. I learned that doctors are just people. They're mechanics.
Mm-hmm.
You know, I take my car to a mechanic. If I'm not happy, I speak up. My body is And I learned that if I was not happy, I trusted, so if I wasn't happy, and you see 3 doctors. You see an oncologist, you see a chemo doctor, and you see a surgeon. And if they are not communicating, you get lost in the shuffle.
It's easy to do.
And so I decided to take control and say, you guys are not communicating. They say, oh, well, there was a miscommunication. I'd say, well, I get that, and that's not okay with me, so I'm going to take control. And when I did, and it was very hard for me, that was 25 years ago, and I took control, and once I did that, things ran more smoothly. So that was a big shock for me. The other shock was, I had rectal cancer, so the other shock was that when I had radiation, they had to come and check my nether region.
Yeah.
And I had doctors and nurses come in to check, to make sure, and they would come in and check me, open the door, the big book that they have, and they'd come in without gloves.
Oh, my.
Yeah, and I'd say to them, hey, hold on a second. Where are your gloves? And this is doctors and nurses. And they say, oh, is that important to you?
And this was 25 years ago?
Yeah, I mean.
Hopefully we're not experiencing that anymore.
And this is in Raleigh, North Carolina, at a major, at Duke University Hospital. This is, and I'd say, yeah. And the answer was, well, I wash my hands when I leave, left the last patient. I said, well, if you can guarantee that when you open the door, the person who opened it before you washed their hands or didn't sneeze. I said, if you want to examine me, go wash your hands and put on a pair of gloves.
And that's a great example of advocating for yourself, and we should do those things.
I would never let anybody touch me unless I saw them personally wash their hands and put on, and I knew they thought that I was crazy. You know what? I didn't give a damn.
I don't think you're crazy. I think you're advocating for yourself. And if I would be horrified if I saw any of that today. So if you do, please bring it forward.
And I still do that. And I know they think.
Good.
And I tell them, when I go in, I say, you know what? I'm going to be the worst patient.
Being a good advocate is that we like those patients.
Kerri?
Online class.
Yes.
Yeah, Kerri, I did actually have somebody that shares that they have a problem telling their family and friends about their diagnosis, partly because she's not accepting it yet herself, and also because her family tries to tell her what to do and how to feel. So she also feels that her friends start to treat her differently.
Oh yeah. So when you tell somebody that you're sick, or when you tell, well, there's a bunch of different complexities in this statement, right? Like, how do we share with others what's going on when we haven't had a full grasp of what's going on? I hope there is one person in this person's life that she has that can come with her to appointments, so she at least has somebody with her. But then when we share with others, I've been diagnosed with cancer, we automatically get a bunch of different responses. We get the controlling family members. You got to do this, you got to do that, you got to do vitamin C therapy, you got to go to this natural path. Oh no, you can't do a natural path. You have to stick to this. You have to stick to Western medicine. But you need better protein, stay away from sugar, you need more exercise, make sure you go do the hyperbaric chamber. All the things, all the different ideas. Well, my grandfather's brother's cousin's uncle's best friend, he had cancer 89 years ago, and he didn't do it like that. But maybe it was prostate cancer and I have breast cancer. All the things, there's that type of response. And then there's the type of response that you hear crickets because they're so afraid to say something wrong. They don't want to upset you. Then you have the type of response to where They just want to talk about your cancer, and life doesn't revolve around cancer, and it gets really irritating when people say, "How are you?" or "You look really good." And one of my doctors, she is a beautiful human being. I no longer work with her, but she was diagnosed with a breast cancer, and she is an oncologist. And I love this moment so much. She was so frustrated one day, and she said, "What am I supposed to look like? Why do people keep saying how amazing I look? What am I supposed to look like?" And it was such a powerful moment, and I'll never forget it. And I thank her so much for sharing her journey with me through that. So you have all of these different responses from others, right? And that's where it's important to put down the boundaries with them. Tell them what you need, because they're not going to know how to support you unless they've been through it with their family before or a friend before that. So putting down boundaries is huge. It's okay to say, "I don't want to talk about it right now." It's okay to say, "I need to talk right now." It's okay to say, "Tell me what your kids did this week because I need to hear something funny." It's okay to say, "I'm not ready to tell you what my treatment plan is," or "I prefer you to not give me your opinions on your treatment plan." It's about putting down boundaries with your loved ones, and that's okay. And some people are going to be okay with it, and some people are going to be frustrated with it. Just keep in mind that they're processing your diagnosis too. Like we go through all the grief and loss cycle, and we often forget, and it's okay to forget. We often forget that our spouses, our kids, our neighbors, our mailman, they all go through it as well. And so we forget that. Our dogs, our cats. How many of you have an animal that drove you nuts in the beginning when you were first diagnosed? Maybe a dog that just would not leave you alone, or a cat that would not leave you alone, because they're processing it as well. Something's happening with my loved one and I don't understand. Was there any other comments, Maya?
Have you had people who've lost friends, whose friends couldn't deal with it and did not show up?
Often.
Okay, so that's not unusual.
Yeah, it's pretty normal. My own very best friend recently passed away from cancer, and she either pushed some friends away that weren't helpful, or she had people that she thought she was really close with just stop showing up. And that was really difficult for her to understand. Yeah, it's pretty common, unfortunately.
It is.
Yeah. And that's not knowing how to respond. That's maybe unresolved grief on their end. That's nothing that our patients have done wrong. Yes.
Some of these drugs that they offer you, especially for cancer, are pretty debilitating. So if you're at an age where you don't want to go through that,
That's okay.
I mean, if you're really old.
Yeah, that's okay. We respect your opinions. We want you to make an educated decision. And so that's why all of the options are presented to you. But that is okay. It is 100% okay to say, "I don't want to do this anymore. I don't want to do this at all." That is okay. We'll make sure we get you guys set up with the good support that you need. Now, when I hear about situations like that of a patient saying, I'm too old, I don't want to do this at all or anymore, or whatever the situation is, I'm going to have the hospice conversation. And I know a lot of the times my patients come back to me and say, "But I'm not dying right now." Well, that's not the point of hospice. We know if you don't treat the cancer, what's going to happen. And I know in my heart that I want you to trust the people coming into your home to take care of you sooner rather than later. I don't want you to have to struggle to build trust in the end. So supportive service in the community is pretty important. Did that answer your question? Okay.
Well, aren't some of these drugs just very debilitating?
Some are, yeah. And it's hard to say, you're going to get this treatment and this is how you're going to feel, because every patient is different. I've had patients who, for example, had a Y90 treatment who should have felt horrible after that treatment, and they felt nothing. And everyone was baffled. Maybe they had a little fatigue and that was it. And I've had patients go on immunotherapy or hormonal medication, and they shouldn't really feel too much, and they felt everything. And then again, we're baffled, right? And so we don't know how patients are going to feel until they have that treatment. And it's also okay to say, I think I want to just try it and see how I do, see how I tolerate it, and then have another conversation later with the doctor. You're welcome.
Kerri, no other comments. I think just for myself, one of the things that I oftentimes think about is sometimes the indignities of having cancer, right, as you're going through your treatments. But the other portion is in a personal situation, we used a lot of humor, and that helped us to sort of get through just our day to day.
Thank you for bringing that up, Maya. That's actually, it's one of my favorite things to talk about during Surviving Survivorship, but it's not even on this list. I love using humor. With one of my good friends who was going through treatment, I sent her a picture. She used to love pictures of my little ones. So my son was dressed in a plush dinosaur outfit, and he was making the salad. He was 2 years old at the time. And I sent her the picture, and she said, I wish I had dinosaurs making me a salad. And so we showed up at her house all wearing dinosaur outfits, and we made her dinner that night. I mean, using humor. Sometimes patients use really inappropriate humor, and I don't care. If that's helpful for you, then I'm okay with it. Some patients love just to laugh and be light and be happy and cry in private. That's okay too. There's something so amazing about being able to laugh through treatment as well. Rewrite your story. Oh my goodness. You guys are not a cancer diagnosis or a critical illness diagnosis. You've got to rewrite your story because you have so much strength within yourself. So you knew something was not right and you went to the doctor. Because of you, you advocated for yourself, and maybe you're doing well now, right? And so you can find your strengths within that moment that you knew something was wrong throughout the remainder of your life. Rewrite your story and find those strengths within yourself. You have to experience the emotions. You've got to let yourself feel the anger, the depression, the bargaining, the joy of acceptance, even if it's brief, the depression. You have to give yourself an opportunity to experience those emotions. If not, it comes out later, and sometimes, like I said, it's just really difficult to deal with, and it comes out really ugly. Some patients really enjoy giving back. There's different ways you can give back. You can be a mentor, you can be a volunteer. There's an organization called Ironman Cancer Angels, and it matches you with somebody who's had a like diagnosis and treatment plan. So some of my patients are now mentors for that organization. Give back. A lot of my patients find peace in giving back to the cancer community. Acknowledging fears calms them, and it helps you move forward. So what does this mean? Who gets scanxiety? Scanxiety, that anxiety before a scan or blood draw, going into the doctor's office, pulling up into the parking lot, that tightness in your chest. It's real, but you got to tell that voice in your head of what if the cancer's back? What if this is happening? What if that's happening? That's why I'm here. Go away. I've got a plan. That's a good way to comment. If available within your office, schedule with a survivorship nurse practitioner. So if you've hit that maintenance phase or off of treatment phase, schedule with a survivorship nurse practitioner and able to help you coordinate the care of what it looks like after a cancer diagnosis.
Where is this person?
Only certain clinics have it. TMC, because a cancer clinic is new, we're building the comprehensive support services, so we hope to have it soon.
So where do you find them if you don't have them?
We can get you connected in the community. Yeah. And then your social work and your nurse navigators, they can also serve as that person at that stage to help you coordinate care as well. Take ownership in your survivorship. Involve yourself in activities. We can't just hide away. We've got to rebuild ourselves. No, life is not going to go back to what it looked like before the diagnosis, but it can look better. It's going to look different, but it can look better. So you've got to take ownership in that. Allow yourself to worry, because then that helps you show up to those appointments and make the plans. Excessive worry is not okay. So that's if your doctor sees you excessively worrying, that's probably when I'm going to be calling you. but allow yourself to really take the time to think about things. Okay, it's part of processing your diagnosis. And for some people, seeking spiritual support is huge. It calms their soul and feeds that piece of them that they really need. And for some people, it's not, and that's okay too. Give me 1 second. So our systems, navigating the systems can be really difficult. And one of you guys already spoke on this, making people talk to each other, making medical professionals talk to each other, communicating with our family, with work, with the community. It can get really difficult sometimes. I hear this all the time. Why do I have to keep everyone informed? All my family, all my friends, the mailman, work, my doctors. Why do I have to keep everyone informed? You don't. And it's okay to choose somebody in your life to be that person. So it's okay to say, all right, Ashley, you are going to be my communicator. You're going to feed the information to everybody because I'm not going to say it 20 times over again. That's okay. I have every ologist and no one ever talks to each other. It's true. There's communication breakdown. It is true. When I see those beautiful moments where all the doctors are effectively communicating together, it's beautiful. And when we have providers within the same system, that communication is very open. But when we go out into the organization, maybe, or into the community, maybe we need to see cardiology and urology and neurology, and we have to see a rheumatologist, but then we have our radiation oncologist and our medical oncologist. It's hard to keep everyone on the same page. If they're not within the same system, I recommend getting a binder and printing your last visit note and keeping it in the binder. That's one way of keeping everybody on the same page with each other. And I know you're thinking like, my binder's going to be too big and I'm going to have 20 in a week. Just try to keep one binder. And a lot of the times the EMRs have a system built in to where when your doctor signs your note, it can automatically go to your care team. So it can automatically go to all of those ologists automatically. So just make sure you tell your doctor, these are the people I'm seeing, and I want to make sure they get my visit note after I've completed. So making the systems work together, you've got to be your own advocate. You have to. If you struggle with it, if you're unable, if your loved one is unable, that's when social work and navigation can get involved and help advocate for you, okay? But you got to be that person. Encourage provider verbal communication. Sometimes we have these complex cases to where we have some worries, and we need our doctors to talk together and work it out. And so that's when I'll get involved and get at each person's cell phone number and match them up. And it's a lot easier for them to ask those questions rather than going back and forth, or an email. Emails work great for doctors too. So encourage that communication between your providers. Delegate tasks. You don't have to do it all. You don't have to do it all. Have somebody do it for you. It could even be like, hey, Joseph, clean the house for me because I'm tired. That's okay. Or calling your social work or navigation like, I'm too tired to clean my house right now. The fatigue is too debilitating. Do you have anything in the community? Yes, we do. We have cleaned for a reason. Let's see if we can match you with a cleaning partner. So there's lots of different things that we can do to help match you with support, even if it's walking your dog. Delegate some tasks to others. Find somebody to be your communicator. If you're too overwhelmed with scheduling and you just can't stay on top of it, have somebody be your contact person so that way they can schedule appointments for you. Whatever makes this a little bit easier for you guys, do.
I think eating's probably a problem with shopping, cooking.
Yeah, you're right. Have you guys heard of the concept grief groceries?
No.
Grief groceries are when your loved ones get together, kind of like a meal train, but they sign up to bring groceries to your house, whether they drop them at the door or they actually come in and put them away for you. And it's helpful because you don't have time to think about grocery shopping.
Who does this?
Friends and family. Yeah. So it's kind of like a meal train, but they go grocery shopping for you instead. And they can have it delivered through Instacart or directly from the grocery store, or they can do it themselves. But it's helpful because at the end of the day, when you were supposed to remember to get milk, but you've just had your provider appointment, then you went and got an echo, and then you had to go back and get labs, and oh, they forgot to draw that lab, so I got to go back again and get more labs taken. You didn't get milk, and you really like milk in your coffee the next morning. So it's helpful if you can involve people in doing things like brief groceries or even cooking for you or mobile meals. Those things are helpful as well. Keep a notebook. So most people will get a informational bag called Bag It, and it's amazing. And it has some space in there to take notes, but take more notes. Anytime you have a question for the doctor that's not urgent, write it down. Put it in your phone. Keep it with you, because I guarantee you're not going to remember everything. It's okay to say no, ask why, ask for clarification, disagree. Doctors are humans. It's okay to disagree with them. They want you to question them. They want to understand why you don't understand so they can help you. Some doctors talk really fast. Some doctors have a very thick accent, and sometimes it's hard to understand them. Just tell them. They want you to understand what's going on. Make the connection. So oncology is like, it's such a special place to be. It's almost like you guys become part of our extended family, and we're that crazy cousin that just doesn't go away. Make the connection with your providers, with the nurses, with the staff in there, with the other patients. Depending on what clinic you guys are going to, kind of depends on what the infusion room layout looks like right now, but you can still get up, wander, and go sit next to somebody. You're not cancer. I heard somebody describe themselves as cancer one day. Well, I'm not me anymore. I'm just this cancer. You are not cancer. Cancer will not control your life. You've got to take control back. Allow yourself to live beyond your diagnosis. And if you feel stuck, ask for help. You became a survivor the day you were diagnosed. So I'm going to turn it over to Maya to get some questions online, and then I'll sit down with you guys.
Hey, Kerri. So thank you for that. I do have a couple of questions that came in. One is, are there groups or organizations outside of your healthcare system that can help you with your emotional and mental health needs?
There's lots of groups, actually. Arizona for Cancer Foundation is one of them. Well, let's start with TMC. TMC has great groups for seniors. The oncology department will be starting groups by the end of the year, in-person groups. And then we have Arizona Foundation for Cancer, and that's just across the road at 2625 Craycroft, and it's on the second floor. They have a lot of different supportive services, but one of them are online groups. And there's groups within Banner Oncology. There's groups worldwide, as long as you're okay with connecting on the internet. So lots of different groups. I try to match people to their specific need rather than saying, okay, here's my list of support groups for you, because I want to make sure you get the support that you need. We also have Tucson Cancer Conquerors, who goes about supporting patients in a different way. They go about moving their body and having a healthy outlook on life. But then they do fun things like field trips and bowlings and hiking trips, and I really appreciate that.
Yeah, I think they actually just did a retreat as well, which was huge. And through Tucson Cancer Conquerors, I know you can also get some peer support, right? You know, because you've got a group together, which is really nice. Is there anything specific that you should ask during your first couple of appointments to help you feel like you can better manage? I know you gave some great tips about keeping a notebook. And I try to think back to my time when I know, what I have been through. And I think one of the things was we did have somebody who was taking notes for us, because in that first, those first couple of appointments, there's a lot, and you're not even sometimes sure what to ask.
Right.
So maybe gathering all that information. Do you have any other tips that you can, that somebody might want to use to better manage those next steps?
I love bringing someone to take notes with you. If you don't have somebody available, ask the office, do you have a social worker or a navigator that can come with me? Taking notes is huge, because like Maya said, you're not going to remember everything. I can promise you that. And we don't expect you to remember everything, because it's too much. Ask the doctor, what priority do you need me to get these things done? What would you like me to get done first? Who can I contact if I'm having issues with my insurance? Really understanding how the systems flow together is really important. So I got a letter in the mail saying my PET scan is not authorized. Now what do I do? It's important to call in when you get that letter, because likely we've already put in the appeal process. So just really coming to us with the questions as they come is really important. If you're good about technology, get on the patient portal. Sometimes it's a lot easier to ask your questions that way too. And one of our team members will get back to you with the answer to that.
Great. The other question that I had is or comment was regarding friends and family. So I know you mentioned maybe whether it's a meal train or the groceries. Oftentimes I know people want to help, but they don't know how to help, and they'll ask you, and you don't know what to say either, right? You don't want to maybe burden a family member or a friend. But maybe can you talk a little bit about ways for friends to support when that happens? I know for me, we had somebody that, they actually said, I could, they can help clean the house, or, if somebody has a dog, maybe it's helping to walk your dog or things like that.
Yeah, and that's excellent. And you may actually have people that come to you and say, well, what do you need? I don't know what I need. And so some different ways that we can support our loved ones with cancer is show up. Do not run away. This is not catchable. It's okay to be vulnerable. It's okay to cry with them. It's okay to express your fears. Is their house messy? Pick up their house real quick if they're okay with that. Do they need help with yard work? Help them with yard work if they're okay with that. Ask permission. Don't expect that these things are going to be okay. Groceries, meal trains, helping with the kids, transportation. Oh my gosh, please help with transportation, because that's a huge one, especially for our patients towards the end of radiation. That fatigue is debilitating sometimes. Talk about something else. Call them, text them, tell them ridiculous moments. My thing is carry moments. So when my friend was going through treatment, I would text her or call her and say, I've got another really good carry moment for you. And just to hear her laughter was really healthy for both of us. There's so many different things we can do. It's almost matching the need of our friend or our loved one. But don't assume, always ask permission to help.
Thank you. That's wonderful advice and some guidance on something that is so difficult for everybody to navigate. Kerri, I want to thank you so much for being here. I'm going to wrap up with our online audience, and I'll turn it over to you to wrap up with our in-person audience. So thank you again for being here today. Really appreciate it.
Thank you, Maya.
Thanks. Thanks for joining us. I hope you'll be back. We have a couple more talks coming up as part of our survivorship series. And our next topic is going to be when surgery is the best option, understanding common procedures in older adults. That will be on Tuesday, October 14th at 11 a.m. As far as our survivorship series, you can join us again on next Wednesday, October 15th for understanding your options, navigating breast cancer care. That will be at 3 p.m. with Dr. Rebecca Viscusi. And our other another survivorship topic that's coming up is the facets of grief and loss after a cancer diagnosis. That will be with Gretchen Stephenson. She is the spiritual care services manager over here at TMC. So I know you will enjoy all of these talks. If you are interested in joining us, please give us a call. Our phone number is 520-324-1960. We hope to see you again. Thank you.